Hello, a very good evening to all of you. Today we are going to discuss the case note of Mr. Philip Hamilton, an alcoholic who is willing to reduce his alcohol intake. And this letter is written to the general practitioner of Mr. Hamilton. His name is Dr. Gregory Miller. The Gregory Miller has to provide support and management for Hamilton's alcohol misuse, managing patients' alcohol intake misuse. So this is what we are going to see. So this is a case. This is a non-case. And now that the patient's past condition, social background, all is known by the general practitioner, so the writing will be a bit easy. I hope so. Let's see the case from the beginning. Yeah, imagine that today's date is 20 February 2021. You are a ward nurse in a hospital and Mr. Philip Hamilton is under your care. Now that today's date is 20 February, that is the data we need here, and you are a ward nurse in the hospital, that also we need here. And now we have the patient name, which is important, Philip Hamilton, and the age is 35. And that's also something is relevant here. Now, the social background here is not needed because the general practitioner knows who exactly he is, whether he's married or separated or brother or what his condition is. All these things are known by the general practitioner. So we don't need that thing there. Now, the medical history, femur fracture, allergies, brother diagnosed with IST. We don't need all these things. Essence, it's a non-case. It's the conditions are known by the general practitioner himself. Now, presenting complaint, severe abdominal pain. Yes, of course, it's needed. So we are going to come to the picture here from 14th of February 2021. This particular day, the patient got admitted through the emergency room with severe abdominal pain. So into your ward, the patient was admitted to your emergency department with severe abdominal pain, and we have a lot of investigations here done, ultrasound, CT scan. Just because the patient complained of abdominal pain, we done some sorts of investigations, and there was no evidence of renal calculi or appendicitis or something like that. Now, no abnormalities seen, so it's not needed there. If we need to include this thing, we need to have some sorts of abnormalities, not abnormalities here. Now, let's go ahead with the next line, that's positively identified acute pancreatitis. Now, that thing is something here. I need to say he got admitted on 14th, that severe abdominal pain. And the next thing is that positively identified acute pancreatitis. The diagnosis of the patient is acute pancreatitis because of excessive drinking. That's a possibility. Now, you have managed with rehydration therapy, morphine injection, and oxygen therapy. So palliative measures have been, oxygen given, IV fluids given. Now, the LFT, the liver function test, confirmed that liver enzymes, LDST, increase. So this also may be because of excessive alcohol intake. So these are all the things that we have seen on 14th, on the day of admission. See, let's go further to 16th and the next date. First, we go with 16. Patient wants supports regarding the stoppage of alcohol, and patient state that he consumed more alcohol after separation from his wife and children, leaflet provided contains information about alcohol in quit social help group contact given. So what we have seen 16th, after 2 days of admission, what we have seen is that patient showed some interest in regarding his habit, that's alcoholism, and started sharing his own problems to us. And therefore we have given some sorts of leaflets which contains information on alcohol abstinence. And now the contact numbers of social help groups, the voluntary groups which are concerned or which are responsible for alcohol abstinence. Now, that 16th of February, we have seen, and we'll just go to the other couple of days on 18th February, what we can see is that positive sign of the treatment, that abdominal pain reduced. Now patient consider to stop alcohol intake. Now he's willing to stop alcohol. So what we have given IV fluids and oxygen, which was disconnected, and his patient is ready for discharge on 20th. That's day today. Now, issues found during hospitalization, this is another thing here. Patient has interest to reduce his alcohol intake. So during our hospitalization, this was the positive issue. This is the positive thing that what we can see here. It's not actually an issue, but it's under thing. The patient had fall from the ladder after drinking excessive alcohol. Now, this is a bit confusion here. Now, some may tell that this might have happened in the hospital. Some may say that it might have happened outside the hospital. Whether it is inside the hospital or outside the hospital, that's not our problem. Our problem is alcoholism. And if we have any injury or any fracture, then that would have been a problem. That would have been a serious problem, which we would have written. Now we don't have to write it because just it's a fall from ladder, and there's nothing significant here to let his GPs know, because as per us there is no fracture or injury or bruises. There is no problem here. Now there's a sample letter here. Now let's go ahead with the purpose of the letter. The purpose of this letter is to seek support for one of your patients, Mr. Philip Hamilton, for managing his alcohol misuse positively. So the purpose is very clear. So I mentioned that we are writing this letter to seek support for one of your patients, Mr. Philip Hamilton, for managing his alcohol misuse positively. So it's very clear. It's formal, it's well written formally. He has been under our care for acute pancreatitis and he's been discharged today. Now, there is condition here, that's acute pancreatitis. The problem started on 14th, he got admitted. So the problem was acute pancreatitis. He has been under our care for acute pancreatitis. He's recovering from acute pancreatitis. He's not just because we have given treatment for almost 6 days, 14, 15, 16, 17, 18, 19, 20. So 6 days treatment. So we have given. So we have written, he has been under our care. So it's a most recent thing. He has been under our care for what? So for acute pancreatitis, and he's been discharged today. So he's been discharged today. So when he's going to discharge, he's getting discharged today. Mr. Hamilton was admitted to our emergency department on 14th of this month. So 14th of this February, with severe pain in the abdomen. So this was the condition when he came to the hospital. A series of investigations were done. We are not going to write ultrasound, CT scan, LFT, RFT, or nothing. A series of investigation, because we need to consolidate these things. We need to get the picture, a brief picture, to the general practitioner. So a series of investigations were done, in which the liver function test revealed. So we have ultrasound and CT scan, there were no abnormalities, there were no renal calculi, there were no some other problems. So if there was no such problems, we would have not written it. We didn't write it. So that's why we excluded those things. So what was the abnormality here, in which the liver function test revealed increased liver enzymes, more likely to be the outcome of excessive alcoholism? Now, what exactly the thing is? Now we have a query symbol there in the question. That's question excessive alcoholism. The query is more likely, the possibility is more to the outcome of excessive alcoholism. Further investigations or further examinations confirm his diagnosis. His diagnosis is already mentioned in the previous paragraph, so we are not repeating it. So further examinations confirmed his diagnosis, and therefore he was treated conservatively, including morphine therapy. We have other IV fluids and oxygen therapy. So those are all conservative treatment based on his conditions. So, but specifically we have written he was given morphine because the GP needs to know what sorts of significant medicines or significant. It's an analgesic, but it's we have different classes of drug. So this is some morphine falls under some sort of a group which is significant, which is to be known by the doctor. So morphine therapy, which is, if it is given, so we need to highlight it. So that's the reason why I have highlighted morphine therapy, and why that's the reason why I excluded IV therapy, which is not that much significant. Oxygen therapy, it's not that much significant. We have said it as conservatively. Now that's it. Now let's go ahead. In a couple of days, just separate this. In a couple of days, Mr. Hamilton expressed his concerns about his alcohol. So he had started developing concerns about his alcohol intake, which he reported to have worsened after his separation. So his wife and children left him. So he's alone, and that's from the time he started consuming more units of alcohol. This is what he verbalized to us during hospitalization. And he expressed his sorts of helplessness, all these things. Now, as a result, what we have done is that we have provided him with leaflets, including information regarding quitting alcohol and contact numbers of social help groups. So social help groups, contact numbers, and please hold. There was a small disturbance. Sorry for the disturbance here. So he was provided with the information regarding quitting alcohol and contact numbers of social help groups. Now, by another couple of days, his pain subsided and showed his willingness to stop alcoholism. Now, we started the paragraph in a couple of days, so we have another time frame towards the end by another couple of days. So it's a connection in the beginning, and the connection is there to close the paragraph too. By another couple of days, his pain subsided and showed his willingness to stop alcoholism. Now, that's what we have concluded this paragraph to, the two paragraphs, the main core paragraphs, which contain information which the GP needed is shared. And now towards the last, the request paragraph, it would be appreciated if you could resume Mr. Hamilton's care after discharge and provide him with adequate help for alcohol abstinence. Now, that's all we have. So we have said if you can resume Mr. Hamilton's carrying on, you were carrying Hamilton, so you can resume the care after discharge. So we are going to discharge today. So after discharge, you could please resume his care and provide him with adequate help for so no, he's willing to abstain from alcohol. So please provide him with the necessary help, which are appropriate to the legal standards or also to the medical standards. Now, if you have any further queries regarding Mr. Hamilton's conditions, condition or care during hospital stay, please do not hesitate to contact me. So what we have done here in the last year, because we are writing to the GP, and the GP knows the medical condition and the social condition, or all the past thing, the baseline data, the baseline medical social data, all is known by the GP. But the only thing what he is unaware of is what happened during the hospital stay. So that's what we have written like that: during the hospital stay. If you want, we already have written something about his admission, the treatment we have given, and the care we have given, and the condition he is up to now. And if he needs any further clarifications regarding the care given in the hospital or the condition Mr. Hamilton was in during the hospital stay, please do not hesitate to contact us. So you're sincerely, Watners. Hope you must have understood this case clearly. Thank you. Have a nice day. Thank you.